So good morning, everyone. Welcome to today's webinar on how employers can improve maternal outcomes for Black moms. I'm Sarah Moore, and I'm joined by my colleagues, Linnea Adamson and Alexandria Williams-Rich, two of our care navigators. Alexandria is a licensed master social worker in the state of Texas and was drawn to the field because of a desire to make a difference. Hey, Tabitha, can you mute real quick? Thanks, Tabitha. Linnea was drawn to the field because of a desire to make a difference and destigmatize mental health challenges in the Black community. After completing her degree at the University of Houston, Alexandria pursued dual certifications in full spectrum doula work, as well as childbirth education, fueled by her passion for confronting the outrageous maternal health disparities faced by birthing families in the US. So that's a little background on Alex. Linnea has worked in the field of social service for over 15 years. She holds master's degrees in both social work and public health and has taught at the graduate level at the University of Pittsburgh. As her passion for maternal and child health grew throughout her career, she became a certified doula, birth doula, and is also a published author and speaker. So Linnea is very passionate about maternal health disparities, and we're so lucky to have both of them as care navigators on our team. This topic of poor Black maternal outcomes has been getting more attention in the media of late, especially because our maternal outcomes in this country are some of the worst in the world. So why should employers and their advisors care? Other than you all being good people, it's your employees that are suffering from the deficiencies in the system, ranging from poor prenatal support to employees dying because their doctors aren't listening to them, which I know Linnea and Alex are going to help to highlight some of those. So today we'll talk about the sad realities of Black maternal health, examples from how we've helped and what supports are needed and are helpful, what you all can do to implement some of those. So without, super quickly, I'll just say this is a hard conversation. I wasn't sure I was the right person to kind of help facilitate it. I'm happy that we have other folks that are the experts joining the conversation. Linnea is going to talk about aftershock super quickly, recommended to our team at BenefitBump that we watch this documentary, and super candidly, I wanted to wait. I was really nervous about crying, about how I would feel, but that's such a privileged perspective to have, to say, I'm gonna wait to confront this issue until I'm emotionally ready to tackle it. And I think sometimes this challenge or this struggle feels overwhelming. We're not sure where to start or how to make it better for our Black moms in this country. So very happy to share with the group today some key takeaways that, again, employers and consultants can learn. But this is truly, it's a discussion for all of us. It's a solution that we all need to be a part of to make it better. So without further ado, I will pass it to Linnea.
Yeah, so I'm so excited to just be having the conversation, because I think we're starting already. I think it's just so important to have the conversation. I think a lot of people are like you, Sarah, that are like, where do I start? And I think just not being afraid to have the conversation is one great place to start. And so I'm so excited to see so many people here who want to be involved in the conversation. I, as a public health professional, as a birth doula myself, came across the documentary Aftershock, and I saw it. I was affected. I already knew statistically what was happening to women of color, but it's different when you see something on paper and you see the statistics. It's different when you put a face to the name, and it's different when you see and hear someone's actual story and realize that the reasons that women are dying are not from, just high blood pressure and things like that. It's from preventable things that are being ignored. And that is where we can move the scale as far as stats are concerned. That is where we can do some things. And so without further ado,
we're going to show a short clip of the documentary Aftershock.
My daughter's story is loud, colorful, and artful. She was awake, aware, and active. And yet she still died.
So with that, Linnea, it's a very moving documentary. I definitely encourage everyone to see it, but we'll unpack some of those statistics facing Black women today. So with that, Linnea, will you kind of walk us through those statistics?
I'll actually turn it over to Alex.
Thank you for that. Good morning, good afternoon, everyone. So yeah, what we've been talking about today, it's serious, it's depressing, it's disheartening to know. But I think for me, at least, it's one thing to have seen and experienced some of the challenges that Black women face in their, not just delivery, but also just pregnancy and fertility journeys in general. But, a lot of us like numbers. So to that end, we do know that in this country, we already have a massive maternal mortality crisis. But to that end, specifically, Black women are 3 times more likely to die in childbirth. And that is when you are controlling for things like income, things like class, health status, things like that. So regardless of kind of who you are as a Black woman, you are 3 times more likely to die than a white woman of a comparable, you're in your peer group. Black women are 36% more likely than white women to have a C-section. And so what that means is when we're talking about complications, when we're talking about issues that happen after the fact, this high C-section rate is directly linked to that because C-sections are major surgery. So you are just more likely to, of course, in addition to the general challenges of birth in general, as your body is adjusting to having given birth, you're also now contending with post-surgical issues that can also create complications. Being more likely to experience pregnancy complications, that is related to both the quality and the quantity of prenatal care received, as well as the other environmental factors. So not to get too deep in the weeds on this, but Black women are more likely to experience this phenomenon called weathering, which is essentially a combination of environmental factors related to the multiple stressors of being Black and a woman in a society that oppresses both. So when we're talking about pregnancy complications, it's not just lifestyle factors per se, it is just the existence of being in our society that creates these phenomenons that are then amplified during pregnancy and the postpartum period. Being the least likely group to breastfeed also has negative impacts on Black women in the postpartum period. Breastfeeding has numerous health benefits, both for baby as well as for mom. And so there are a variety of reasons as to why Black women are less likely to breastfeed, but they are also mostly related to healthcare. So if your doctor is not willing to hear you out on, getting you in touch with a lactation consultant, you may not have family that is breastfed before, so you don't know where to start, so you don't bother. And I think the biggest piece of the challenges facing Black women as it relates to maternal mortality is the premature birth risk. Black women are 14%, almost 15%, having premature babies, which is about 50% higher than white and Hispanic women. And so what that means is, obviously, premature births create additional health risks, both for moms and for babies. And so again, this comes back to both the quantity and the quality of prenatal care received, as well as some of those environmental factors related to weathering that I discussed a minute ago. And something I find personally interesting is just that these issues, right, are not just related to pregnancy, to delivery or birth. We also see them before Black women are even getting pregnant. Black women are not easily able to access fertility services. And a lot of that has to do with the quality of health insurance they have access to. Obviously, if you are on Medicaid, that is not going to provide services for IVF or even testing for fertility issues. So if you are already like low income, you're less likely to find a doctor who's willing to work with you. And if you are, what I've observed personally in my work here at BenefitBump is that a lot of Black women are not being well educated on their options when it comes to family building, when they are pursuing fertility treatments. Okay, so I gave you some of the numbers, and as I touched on a little bit of the why during the previous slide, but I really think that it's just important to highlight the fact that there's not something latent or innate to Black women that makes us at fault for our maternal mortality. It definitely something that Aftershock goes into, that when we're talking about being controlled for income, right? Even wealthy Black women are still facing these same issues. I'm not sure if folks on the call here are familiar, but both Serena Williams and Beyonce Knowles, multimillionaires, had pregnancy complications that almost led to their deaths. So if multimillionaire Black women are still not having their voices being heard while they have access to the best doctors, while they have access to the best care, what does that say for the average income Black woman? And a lot of it comes down to bias. It comes down to systemic racism. There are studies that show that healthcare professionals do not believe that Black women do receive and feel pain, that our pain tolerance is higher than that of other groups of women. So if I'm telling you that I'm in extreme pain and your first instinct as a nurse or a doctor is to consider me drug seeking, which happens, or just to believe that I'm faking it for whatever reason, then yeah, of course, that's going to lead to additional challenges if my pain is not being validated. And so what we also see is, and this is what I will say is an issue across the board, but because Black women are more prone to pregnancy complications, it affects us the most starkly, is that our healthcare system loves pushing people towards C-sections. It's easier on doctors, it's easier on hospitals, because of course you can schedule, if you can schedule a C-section, you can kind of, right, when the person's going to be in and when they're going to be out. It's easier to get a timeline of a C-section versus a vaginal labor and delivery, because those are a lot more unpredictable. Because obviously, if you do have a scheduled C-section, there's a pretty good chance you actually will give birth before you even go into labor. So you're just in and out. But when we're talking about having these additional complications after the fact, like I mentioned in the previous slide, having a C-section raises those risks after the birth, because if you're already not being listened to ahead of time, having surgical, the additional pressure on your body from surgery is not going to help that at all. And when Black women are also less likely to have access to prenatal care, that's for a variety of reasons, but also comes down to health insurance and just the general access, right? If I work in a job that does not give me good time off to go to my prenatal appointments, I will skip them. Or, if I feel that I don't have supportive management who isn't willing to give me work accommodations, I'm just going to try to push through my needs. And overall, we're talking about class, but even when controlling for class, these are issues, but, obviously these impacts are felt most strongly for poor Black women. A resource that I love, that I've read for my doula training, is Killing the Black Body. It's not an easy read. If you think Aftershock is hard to get through, so is this book. But it is, to me, a very necessary read if this is something that you're interested in, because it really labels the history of this issue, going back from the way that Black women's reproduction was controlled during slavery into the Jim Crow period, and the ways that the government tried to suppress fertility as it related to people being on welfare. So it's like, hey, if you want to keep your welfare benefits to support your children, you have to go on birth control. And if not, what those outcomes were, and like the, snowball effect. And that we still see and hear rhetoric about today. But yeah, that's a very, I guess, quick and dirty history and overview of how we got here. So I will go back to Linnea, I guess, on explaining what employers can do to support their birthing parents.
And super quickly, Linnea, before you cover the next slide, we did get a question in the chat as far as, do Black OBGYNs, so Black medical providers, have better outcomes for their Black patients? What we've seen in the stats is that 4 in 10 Black women ages 18 to 49 say that a Black healthcare provider is better than others that at looking out for their best interests, at education, at things like that. But we'll continue to look for data that suggests that having a Black healthcare provider actually reduces complications, because I think there are a few other studies that the team is citing currently that having access to a Black healthcare provider, Black OBGYN, significantly reduces, it looks like, about half of the prematurity rate. So we'll definitely follow up with some of those more hard data and statistics on that. And then just thinking about how we're supporting, I'd like to actually cover the next slide, because I want to get into doulas. Alex and Linnea, when we talk about, okay, we know there are biases in the practice of medicine. So what can we do, again, as an employer group or as those employers' consultants, what can we do to help kind of combat that racism in the practice of healthcare, and then otherwise connecting to those other resources that have an impact? So Linnea, super quickly, if you want to cover how doulas can help, would love to get to that next, because that definitely seemed to be the number one thing that bubbled up from our discussions as to how to help.
Definitely. And so, just very quickly, some people get doulas and midwives confused, and that they're interchangeable, but they're not. A midwife is a medical provider. A doula is an advocate, a support. A doula is there to be of service for that mom. And so I also, as well as Alex, have training in being birth doulas. And so I've attended births, and like I said, I've seen with my own eyes what happens in the delivery and labor and delivery room to Black women. Nurses and doctors are coming in the room. They are taking blood pressures. They are making decisions. They are ignoring the woman who's saying, I have a headache. Oh, that's just normal. Pacifying symptoms and things like that. Those are things that I can read about and say, like, oh, that can't cause maternal mortality. That can't cause morbidity. Like, but those things all together are what is causing that. Because if I'm ignored at the hospital and I get home and I have that same headache that might be caused by high blood pressure, or I might be having some other serious complication, if I was ignored in the hospital, I'm then gonna believe that I'm gonna be ignored when I'm at home. And if nobody is checking in on me, such as a postpartum doula, and saying, how are you feeling? How are you doing? How's the baby feeding? How are you, emotionally? And if nobody is saying, well, you know what, you should not have a migraine for 2 days at this point, and I'm constantly ignoring this fact because I was ignored in the hospital, then I might be less likely to call the doctor and say, something's going on. And then if I am then ignored and said, oh, that's normal, and you'll see that in the documentary Aftershock. These are the things that are happening to women of color who are saying, you know what, something's not wrong. Like, something's wrong. Like, I am out of breath. Even me, as I was not pregnant when this happened, but I had blood clots myself, and it wasn't caused from pregnancy. And I let it go on and on and on. And, oh, you're just having asthma, or it's just this, or this, it's just that. And by the time they actually went to the hospital to get it taken care of, it was too late. And so these are the reasons that women are dying. And so when you have a birth doula, a lot of times I am trained to hold a leg. I am trained to explain to a woman what is happening during labor. I am trained to help them be comfortable, to have the best birth experience possible. But what I've seen for a lot of women of color, I am simply there to make sure that their voice is heard. I am there to make sure that they are not being ignored and that their symptoms are not being ignored. And that is the number one factor in why women are having better birth outcomes and better birth experiences, and statistically why women are having better outcomes, because we cannot lessen or decrease how much those little advocacies impact birth outcomes, because women are not being listened to. And that is what it comes down to.
Linnea, tell me how you feel about this. So again, in our discussions, those birth doulas are so important in impacting the trajectory that may have been a poor outcome into a better one. We have a client that's in Minneapolis, a manufacturing client that is paying $2,000 per mom to get access to birth doula support. How do you feel about that as an employer solution?
When we look at, okay, so a woman, they are providing $2,000 for a doula care. That is providing prenatal care, someone to go with or to visit mom at home to see how she's doing, to see if she needs to be on bed rest, to go with her maybe to the doctor, to the appointment, and to explain to her. You might have a doula who's sitting down and working on a birth plan. What do you want to happen during labor and delivery that you will have a better birth outcome and better birth experience? You're having a doula during labor and delivery, and then you're having a postpartum doula. That covers all of that. Somebody to check in on you afterwards, because a lot of women are dying right after childbirth. A lot of the things, complications that come right after a C-section or right after having the baby. And so having someone to lay eyes on you that knows what to look for, those are the big things. And so to have all that covered is invaluable. And when you look at the statistics, that's lowering her getting a C-section, which we know costs more. That's lowering all these other medical complications that may come just from that person. You know, we can't invalidate how much having someone, a calming and peaceful labor experience has on the body, just relaxing and having a baby with less medical intervention. And so that is just awesome. Having those types of benefits really is invaluable, especially to women of color and especially dealing with this issue.
Well, I think, Linnea, in addition, and Alex too, because I know this came up in our discussion, in addition to having, you know, doula benefits like the client in Minneapolis that provides that subsidy, midwives, you know, making sure doulas, midwives, birthing centers are covered. So that's the direct access to care. What else can employers do? We've talked about, you know, beefing up paid leave. We've talked about the stressors that contribute to a poor outcome, stressors like financial, like childcare, like breastfeeding, like time off. What are those other types of things that can impact a mom? And I guess, how are you both helping moms with those things and seeing outcomes?
For sure. I don't mind kind of jumping on that. For me, at least in my role as a care navigator, my first question to a pregnant mom is, you know, what are your stressors? Like, what are your biggest issues right now? And you would be surprised how willing these women are to just spill everything that's going on in their lives to a complete stranger, because there are so few outlets, right? Everyone regards pregnancy as like, oh my gosh, it's the best time of your life. It's so beautiful, it's so wonderful. And like, while that is great and awesome, there are a lot of concerns that come along with it. Number one is generally childcare. So many of my moms are like, oh yeah, I give birth, you know, in 6 months, but the daycares near me don't have openings for another year. I have no clue how I'm going to manage childcare until then. I'm like, well, I obviously cannot provide direct childcare. What I can do is direct them to employer resources. And in those moments where employer resources are less than sufficient, that's when I'm doing like my own childcare resource searches. How can I support this mom in figuring this out? If, you don't get, adequate time off, how are we able to maybe get creative with leave options, with support? What networks, what personal networks can they tap into? And I think just having someone who is able to hear you out and answer those questions you may not have even asking the questions that you may not have even thought about. I've had moms who are in their third trimester who like, I haven't thought about childcare yet. I didn't know, right? Just having that listening ear is so key. Every single mom that I talk to, I always send them over a birth plan when I'm following up with them, no matter how early or how late they are in their pregnancy. I always talk to them about a birth plan. I'm like, just because even if you don't have a doula, it never hurts to have someone informed. Where I think doulas really benefit is this, we are taught as a society, doctors know best. We always defer to doctors' knowledge and opinions on things. And so if you are if your wife is giving birth and you're her husband or you're her partner, you don't necessarily know what's going on. And the doctor's saying, oh, well, we need to do X, Y, and Z. And your wife doesn't know what to do. And you're like, oh, okay, I guess, right? But that obviously doctors are not always making the best decisions for their patients. And for me, when participants cannot necessarily access a doula for whatever reason, just sitting over that birth plan and saying, this is what I want to happen during labor. These are my ideals. That helps any support people that they have with them, doula or not, go in more informed. And so they are better able to advocate for that person while they are in labor and not, of course, able to make, really quick decisions on the fly for these really complicated situations that might come up. I think one of my favorite experiences that I've had here is helping a mom find a doula. She didn't get in touch with me until she was, I think, 36 weeks. So we were talking at the end. That was when she signed up with BenefitBump. And so our first call, she said, yeah, I kind of just found out what doulas are, and I think I want one. I said, okay, you're going to get a doula. If you want a doula, you're going to get one. And so she was able to get one and have the birth experience that she wanted. That was not her first child, but she wanted one for this pregnancy. And I really busted my butt to make sure she got one. And that's, again, the nature of the work, not just, of course, we can't be there in the room with them, but having them know that there is someone there who is listening, who's going to validate their fears, validate their concerns. I think that also just makes a huge difference in these women's pregnancy as well as their birth experiences. And I love it.
Well, Alex, I think you did a nice job setting the stage for the best side. So here at BenefitBump, I mean, we really believe in good, better, best solutions for employers and consultants. Like, what can you all do today? What can you do within the next year? What can you do within the next 3 years? And Alex, I love how you're helping moms find access to and understand all of their benefits. You touched on leave, you touched on financial resources, you touched on doula care, you touched on child care. So I mean, obviously, we like to think that we're on the best side of things, again, accessing whole wheel or spectrum of different support services through Alex and Linnea. Thinking about if you're not proactively communicating in a hand-holding way like we do, on the best side, what can you do today, tomorrow, to start pulling this together and creating a better experience and getting your Black moms to a better place? First, we talk about the lack of kind of education on resources that are available to them. So creating, a 1-pagers, 2-pagers, easily accessible documents that provide like a detailed outline of all the resources available to those expectant parents. So it's easily digestible information at their fingertips. So they know kind of what to expect and what those various resources are within your organization. Secondly, on the good side, the community of support for moms. So we're seeing a lot of ERGs around parents and caregivers, but how can we kind of slice and dice that to make sure that Black moms' voices are being heard and we can address those, create that community within our organizations, and then see what are some of those additional needs that need to be met within that organization. Lastly, I know we are strong proponents of the National Maternal Mental Health Hotline. If you're doing that one pager on supports and resources, definitely include information on that, because this is an exciting time, but can be very stressful, as Linnea mentioned. So moving on to some of those better solutions, definitely reviewing insurance to make sure doulas, midwives, birthing centers, breastfeeding supports, how much it's going to cost that mom to get access to a pump. The supplies are also really, really expensive, and we don't think about those until kind of going through it. So making sure access to those different resources and lactation supplies is also affordable for those employees in your organization, and also who's available, or I guess who has access to the benefits that you're making sure have doulas and midwives. What percentage of your workforce has access to it, and what is that percentage that doesn't have access to insurance? What does that make up? Obviously want to see that expanded there as well. Opening up conversations about experiences and challenges with this population in your workforce. Again, the ERG is a great way to do that, but definitely want to facilitate those conversations with consultants, with educators, with some of those professional folks, so that some of those pain points can be teased out and then addressed. We think it's a great idea. Additional antepartum leave in the event of an adverse outcome beyond short-term stability. I think our team, Linnea and Alex, I know we could talk about this forever. I know we're already a little bit out of time, but we're very passionate here at BenefitBump. We could talk about this for days and days, but looking at the leave for what happens with a stillbirth, what happens in that postpartum period, even reviewing short-term disability policies, making sure we're topping those up to 100% for pregnancies that end up being viable postpartum, but then if not, what are we providing to those moms as well? And lastly, on the best side, making sure, again, employees know and take advantage of all of the workplace. I mean, a number of you on the call today, employer-wise, offer some really great benefits and resources. It's just making sure those employees know about them in a timely way and take advantage of it. So Alex, you really hit on that, how we're able to deliver that. Moving on to the next point, so it's not a BenefitBump commercial, providing grants to offset the cost of doulas. Again, I know we touched on that for a good amount of time, but it's definitely impactful and can also save employer dollars if you're seeing high maternity claims costs come through. Mental health resources that focus on the challenges new mothers and parents face. We love Canopy. Please feel free to check them out. Really great CBT that's baked into our program for those moms. And then lastly, because again, we want to be mindful of time, but establishing those emergency relief funds. So one of our clients has a program where they have emergency relief funds for their employee population as they're going through tough times. That can help with transportation. It can help with when those financial emergencies arise. And you'd be amazed how often that's happening with pregnant employees. And so being able for Linnea and Alex to connect to those emergency relief funds is so vitally helpful as we're supporting employees. Because again, we're connecting to everything an employer has, in addition to everything that's offered in the public space as well. Diaper banks, food banks, formula banks, all of that. So questions, let's get to them because it's time, and we appreciate you all being able to go over, but definitely want